So I think we've got a roving microphone. So if you could stand up, say who you are, and ask your question. Yep, we've got a couple of... there's a microphone coming to you. And who would you like to answer?
They are related. I want to ask, because obesity is so important, medically, if you do the lab surgery to do the surgical treatment for the obesity, I think the Medicare does not cover the cost, correct?
Yeah, we're going to talk about surgical treatment in the breakout sessions afterwards. So you'll have an opportunity to talk in a small group with about that. I don't know whether anyone here wants to comment on surgery.
We wish they would all cover it as well to make our life a lot easier.
Right.
The thing is that people like to say over BMI more than 40% for the young people, and if the obesity is so important, and then I think is that surgical treatment is optional?
Yeah.
In that case, the diet exercise probably take a longer time.
Sure. We are absolutely agree entirely, but we're going to come back to that if you don't mind. We've just got a limited amount of time. There's a couple of questions just over here.
So I'm Jane Novotny, I'm a GP in Balmain. You mentioned that the gut biome was geographically related, and particularly you mentioned China. So with all the imported foods now, how do we know that that's not the reason for our excess obesity? That, you know, we're getting the wrong bugs?
Yes, I mean, I think it's the the constituents of that diet are more important really in terms of your caloric intake. So if you look at what you eat and then the total caloric intake, that's far more important, I guess, ultimately in terms of obesity. But you're right about whether, you know, things that are imported from one place to another can transfer the microbiome of that particular soil. I guess at the end of the day, it's a small factor. It's far more important where you live and actually interact with other people, and in that particular geographic location, as opposed to the small input that comes in from diet from elsewhere. But more importantly, I think,
people moving to Australia.
Correct. Yeah. So these kind of migration studies have been done, and it's interesting that sometimes with certain conditions you acquire the risk of the country that you emigrate to, as opposed to the one that you came from. So it's a very complex situation in terms of the migration studies. But I think where you live and who you cohabit with, ultimately, you know, for a long period, is going to determine your health risk, as opposed to, you know, kind of short changes that may not be as sustainable.
It's Anna Singer from Rosebery GP. Again, about microbiome, you mentioned that what determines microbiome is the maternal gut flora, etc. So, however, you also said that lifestyle seems to be more significant. So, proportionally, what's actually contributed by our, I suppose, maternal environment?
Sure.
And how significant is that proportionally? Thank you.
So initially it's very significant because the majority of the microbiome is acquired from the mother. So if the mother is, for example, transferring a dysbiotic microbiome, that will have an impact. And if you look at the population-wide, that is very relevant. For example, if you look at cesarean section rates, this will correlate with increased risk of certain, you know, conditions. But on an individual basis, I don't want people to panic if you've had a cesarean section or whatever, because you can overcome, you know, that kind of baggage that you've inherited by adopting a healthy lifestyle. So that is actually, a way out, and that's why it's important on a population level that we adopt all the healthy lifestyle. You know, good diet, exercise, physical activity has been mentioned several times. That has a very positive effect on your microbiome, and so many beautiful studies published on physical activity and its impact on the microbiome. So you can overcome what you've inherited if you follow a very healthy lifestyle.
We need to make this the last question, I'm sorry. Yeah.
Liz Hovey, medical oncologist, Prince of Wales. Another question about microbiome. You showed the slide about the maternal transfer, and you also mentioned that there was a study where they looked at oral, vaginal, and the gut. Yeah. What kind of interaction is there between oral, vaginal, and the gut in terms of determining your gut microbiome?
Beautiful question. And I think, so in that study, After 4 months, there was niche selection. So the gut-related mother's microbiome ended up in the gut. The oral ones ended up in the oral cavity. But it's very important, this concept of oralization of the gut microbiome. This is emerging as a very important risk factor for many cancers. So we're finding bugs that should be, that usually are found in the mouth, for example, like the fusobacteria, cropping up in cancers that are distal to that, for example, in colon cancer and pancreatic cancer and many other kind of cancers. So oralization of the gut microbiome is a very important concept in this field.
So we'll have to stop there. There's, I think, more information on the microbiome on the TCRN website, and we'll be pointing you to more information in the slides that were presented. I'd like you to thank all of our presenters in this panel session, and I'll give them something that hopefully won't adversely affect their microbiome.